Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 13 video. This is your last video of the series, and our topic this week is quality in long-term care. So what is quality in long-term care? Quality in long-term care is really the goal of maximizing the well-being of long-term care consumers. A lot of students say, well, isn't this the same as culture change? No, culture change is really a way that we use that quality data to try to make changes. Culture change strives for quality improvement, but it's often a separate, disconnected entity connected to the idea of quality. So how do we define quality? Well, this is really hard, not just in long-term care, but in healthcare and public health. The text talks about how quality can be viewed as structure, process, and outcomes, and I think that's a good way to think about quality. Some people with a business background might have learned that quality is often a good return on investment, and so that's another way to think about quality in long-term care. One of the things that's really hard about quality care in long-term care is, unlike the acute model or primary care or public health, long-term care consumers don't necessarily have the benefit of getting better. So it is not as easy to capture quality data as for some of the other health models. So it's been argued at times that perception of quality is more important than long-term care than it would be in a hospital or in a doctor's office. Text also mentions CQI, or continuous quality improvement. You can think of this as more of like an ongoing feedback loop as opposed to taking one data set of quality measures and looking at them. It's important to have continuous quality measures because rather than reacting to something that went wrong or quality standards low, this is an ongoing process. So ways that long-term care improves quality, I'm going to give you a couple examples. The first is a QIO. QIOs are quality improvement organizations. CMS, the Center for Medicare and Medicaid, contracts with QIOs, 3-year contracts to cover the state. These are different agencies, so you can look up, if you're outside of New England, who your QIO is. New England shares pretty much a QIO for all the 6 New England states. These outside agencies review complaints, but it's somewhat limited to Medicare consumers. And as we know, long-term care includes Medicare, Medicaid, privately insured consumers. Another way that quality is measured and improved is through the ombudsman programs. Ombudsmen are in all 50 states. They review and respond to complaints about consumer care in long-term care. They get to cover Medicare, Medicaid, and privately insured consumers. So unlike the QIOs, they have a broader base to collect data from. Ombudsmen will track those consumer complaints, and they're compiled nationally, and that's often used to make quality improvement changes. Another way to improve quality that we've talked about is through the licensing divisions. Now, as we know from weeks prior, facilities and home care agencies have to get a license to provide their services. Those are regulated by the states, and often the state ties to their license some quality measures. However, this is usually the floor of quality measures, not the ceiling. Licensing divisions are able to require that facilities meet certain regulations, and that includes to quality measures, but they can't really go above and beyond that. So if it's something new or something that is should be done but is not in regulation, the licensing division really can't do anything about that. And then there's the internal quality team. So a lot of the large corporate models that own many different long-term care facilities might have a corporate quality team, or actually the singular facility might have a quality team. And what this team does is it really goes through the data being collected about quality, or maybe talking about the perceptions of quality. This might run alongside or next to or overlap with a culture change committee, but they're often separate. So I want to give you one last important point is the data that we collect about quality is super important because we can't make decisions about quality until we have really good facts about what's actually going on. So as public health students, you know how important data is, but I just want to put in a plug for that, that often we can't make really important changes unless we have really good data to work from. So that's it for week 13 in the course. There is a week 14 listed, but that is not required. We're not using it this semester. If you're interested in the future of long-term care, feel free to go through the materials. As always, I'm here for your questions, comments, or concerns. Please remember that you have the policy brief due at the end of this week. Thanks, it's been a great course. I hope you enjoyed it and feel like you learned some substantive aspects of the long-term care system. See you soon.